you notice that something is wrong with your dog. She is not as active as usual. She doesn't run to the leash. She gets up slowly. She may even refuse food. Most people think at this moment, maybe she's tired. Maybe it's hot. It's nothing serious, it will pass. But this is often the exact moment when babesiosis begins, a disease that can kill a dog in just a few days. Babesiosis is not a simple infection. It is a parasitic blood disease transmitted through a tick bite. Sometimes just one bite is enough to start a process that cannot be stopped without urgent treatment. When a tick bites a dog, it can transmit a parasite called Babesia into the bloodstream. This parasite does not cause coughing, sneezing, or diarrhea. It works silently. Babesia enters the blood and penetrates red blood cells, the cells responsible for carrying oxygen. Inside these cells, the parasite begins to multiply. When there are too many of them, the red blood cell is destroyed. This happens again and again. The blood loses its ability to carry oxygen, and a huge amount of toxins is released into the body. Essentially, the dog's body begins to poison itself. From the moment of the tick bite to the first symptoms, it usually takes between 2 and 10 days, sometimes longer, sometimes shorter. It depends on the dog's immune system, age, and overall health. The first signs almost always look harmless: mild lethargy, reduced appetite. The dog lies down more than usual. It may seem like she's just not in the mood. At this stage, the body temperature is often around 40 degrees Celsius, but most owners never measure it. If you see a veterinarian at this stage, the chances of full recovery are very high. But if the disease continues to develop, the condition worsens rapidly. The dog becomes extremely weak. She may struggle to stand. She completely refuses food. Breathing becomes rapid. The gums turn pale or yellowish. And then one of the most dangerous signs appears: dark urine, the color of beer or cola. This means that destroyed blood cells are already being filtered through the kidneys, and the kidneys begin to fail. At this stage, time is measured not in days, but in hours. Without treatment, kidney failure develops, the liver is damaged, and heart function is disrupted. In severe cases, seizures, loss of consciousness, and coma may occur. And here's the most important thing to understand: babesiosis cannot be treated at home. No human medications, no injections recommended by friends, and no folk remedies will work. If babesiosis is suspected, the only correct decision is to go to a veterinary clinic immediately. At the clinic, the veterinarian starts with an examination and blood tests. A blood smear, a complete blood count, and biochemistry tests are done to assess organ damage. Sometimes the parasites are not visible right away. But that does not mean the disease is not present. In such cases, treatment is started based on symptoms. The main treatment is aimed at killing the parasite. Special anti-Babesia drugs are used. Yes, these drugs are toxic, but without them, the dog will die. After the injection, the condition may temporarily worsen. Weakness, apathy, and nausea may appear. This is a normal reaction because the parasites are dying and the body is dealing with the aftermath. But treatment does not end there. Even after the parasite is destroyed, a large amount of toxins remains in the bloodstream. That is why supportive therapy is essential. IV fluids, liver support medications, kidney support medications, and vitamins. In severe cases, oxygen therapy or even a blood transfusion may be required. The acute phase of the disease usually lasts from 3 to 7 days. After that, a recovery period begins, which can last several weeks. And here many owners make another mistake. They stop treatment too early. Just because the dog looks better does not mean the body has fully recovered. After leaving the clinic, the dog needs rest. No physical exertion, a light diet, plenty of water, constant monitoring of her condition. Even after full recovery, Babesiosis can leave long-term consequences. Kidney problems, liver problems, reduced endurance, and most importantly, reinfection is possible. That is why prevention becomes essential. Constant tick protection. Checking the dog after every walk, regular treatments. Babesiosis is much easier to prevent than to treat, and far easier than going through it again. And if there is one thing every dog owner must remember, it is this. If you even suspect babesiosis, you should already be on your way to the clinic. One lost day can cost your dog's life.